knowledge and experience with us. So please welcome James.
Thank you, merhaba. That's my one. I know a few other Turkish words, but you wouldn't understand them. So I am. What do I do to make this? Did you turn it on? Okay.
It's good.
Oh, okay. That's good. Thank you very much. Now I'll start again. So I am a social worker in the United States, and I've been a social worker for 34 years. Most of that with schools, working with teachers and children with disabilities, many times children with behavioral disabilities. I've also worked in a medical setting for a number of years with children with very severe medical conditions. And recently, the past maybe close to 6 years, I've been a social worker at Northern Arizona University. I travel out onto the Navajo Indian Reservation, and I help families that have children that have disabilities get the services that they need in school. I also help families if they have children with challenging behavior. Many times they don't know what to do, and actually many times teachers don't know what to do. On paper it looks like they have the resources to help them, but in real life they don't. Over the years, one of the things that I've discovered time and again is that if a child has what we call an invisible disability, that is so difficult for teachers and parents to pay attention to and to give them the support that they need. There actually are quite a few invisible disabilities. And so it's a genuine impairment that a child or a person has, but it's not easy for those of us, just part of the lay public, to see. There's asthma is one, arthritis, epilepsy, except when the person is actually having a seizure. High-functioning autism, that's also called Asperger's. Those individuals can look like, wow, they're smart, but they're jerks. So, but actually, when they act in certain ways, it's because of their condition. Attention deficit hyperactivity disorder, or ADHD, is an invisible disability. Those children oftentimes get our attention because of their very, very active behavior. And not active in a sweet way. Active in your face, active too much. It's easy to feel irritated with those children, to blame them, to get frustrated and angry with those children. That's one part of it. The other part, which is when children have trouble paying attention, following directions, the inattention part, having trouble with homework over and over and over again, organizing. Teachers get very, very frustrated with that. And it's easily just to blame the child and give up on trying to help them. This man, Matthew Langman, is an instructor at the university that I work at. And you'll notice he has a helmet on and he has kind of a long pointing tool coming from there. Matthew has cerebral palsy. He is not able to walk, to talk, to care for himself at all. He graduated from University of California at Berkeley, which is a very, very good university. He's very bright, but his body cannot do what he would like it to do and what we wish it could do. So he has to have ongoing support in order to function. This alphabet here, he uses that pointer to point at letters. He spells things out, and somebody, like this young man here, is near him and will help him to say, okay, he's spelling this out. I think he'll ask, is this the word you mean? And he says yes or no. He needs that. He needs help with toileting, with getting to bed, eating, everything. He needs his power chair. He needs a ramp to get in the building. He needs ongoing support. It would never occur to any of us to say to Matthew, you know, we've been doing this for 3 months. You should have it down by now. We're going to take away some of these supports. We know he must have them to function. Okay, these are children that have ADHD. You can see that little one in the corner there. A lot of times we picture that wild child, and that little guy that looks like he wants to give you a hard time as a teacher with that pencil. They are in your face, they're full of energy, but there's the other side to it. They have difficulty with social skills. They sit there and daydream. They're a little oppositional at times. This boy's writing, I will do my homework, and this girl's writing, I will not talk in class anymore. Those are kind of the stereotypes of what we think of with children with this disorder. And many teachers would say, these guys could get this under control. They look basically pretty normal. They're just, you know, a little spoiled. They need a strict teacher. Okay. Actually, though, ADHD is a developmental disorder, and it's a neurological disorder. It affects the brain, specific parts of the brain. Those children, in order to function successfully in school, and actually, by the time they're an adult, they also, if they still have ADHD, and a large percentage of people with ADHD go on and keep the disorder as an adult. Some do not. They need ongoing supports to function successfully. They need visual prompts. They need opportunities to release energy. They need really concrete, organized help with study skills. It's very tempting if you are helping a child learn how to study or learn the class rules. It's so tempting to think, you know what, I've been doing this the first 6 weeks of class. Everyone else has got it, but this kid is still giving me trouble with it. Or if the kid's doing fine, oh, let's just take it away. I see that a lot. Teachers think, oh, good, the program is working. What we're doing is helping. So they think he's got it mastered or she's got it mastered. They stop doing it, and the behavior returns again. So I can't emphasize enough how important it is to make sure that any support you give is ongoing. This is a little socio-political critique, just to remind us all that these children that I'm describing, they have to function in schools that are very rigid many times, have really strict structures, ideas about what tasks have to be accomplished by when. And those specific demands that come out of wanting children to be able to get a job when they get out of school, those are not very flexible. What can end up happening is those kids get really alienated. Not just those kids, other kids that don't fit the mold that are different, are diverse. And so they can be alienated, they can feel inside as if they are truly not as good as other people, that they just don't fit with the rest of us in life. So this universal kind of homogenized behavioral expectations that we all have, unfortunately, this is where kids have to go to school. There are no non-stigmatized educational alternatives. In the United States, sometimes children that are struggling in school can go to an alternative school where the bad kids go, is what everybody knows. So you really, as a parent, you would rather your child not go there because that's where the dropouts and the druggies and that kind of thing go. It's so easy to turn a blind eye to these children because they are not easy to help. It takes energy from the classroom teacher. In the United States, where there are all kinds of laws and I can help a school to realize they need to help a child with ADHD, even there, it is still on the classroom teacher. The supports do not come in consistently for the teacher. I think it really helps to have a genuine understanding of what ADHD is, because you will feel frustrated with that student. And I wish I could say that you will get lots of support, but you'll need to create your own resources to help you. Okay, so today I'm just going to go through. I'll talk very briefly about etiology, history, the current definition of ADHD, and this, of course, is in the United States. And I know for many years there was a question, is ADHD just an American invention? But actually, it turns out, no, we didn't invent it. I'll give you a few statistics. We'll go over the symptoms pretty much because I want you to be really clear what it looks like. Talk a little bit about ADHD and the brain, the parts of the brain, and then treatment, support, and accommodations. When it comes down to ADHD evaluation and treatment in Turkey, I had great difficulty finding out what that looked like. Luckily, I have a research assistant here from Disability Support Services, and she can help with that. And then I also understand we have someone here today who is a teacher in the eastern part of Turkey. Oh, very good. Because she can help us know what, I think Hila will be able to tell us what it's supposed to look like. You may be able to tell us what it looks like in real life. And we can have some discussion about what can we do with that. And then I just have a list of resources that I know about. So, first of all, ADHD is primarily a genetic disorder. Most people with ADHD have other relatives in their family with ADHD. 2/3, it's a biological genetic disorder. 1/3 comes from a brain injury that happens in the womb during pregnancy. Where I work on Navajo Nation, alcoholism is a huge issue, and those children whose mothers drank during the pregnancy can get fetal alcohol syndrome disorder, and that has ADHD as a component. But it isn't just from alcohol. It can be something that happens in the womb that nobody is even realizing is going on. It can be prematurity. There are a number of reasons that cause a brain injury in the womb that would affect that part of the brain. So very briefly, the history. I was shocked to discover back in 1902, there was an English pediatrician who, for the first time, they count this as the start of the scientific awareness of ADHD. He called children that were extremely active and had trouble controlling their activity level, he called them having an abnormal defect of moral control. That sounds But you know what? In real life, when I talk to teachers, they don't use the word moral, but really, they think those kids are bad. So I'm not so sure we've come that far. In the 50s and 60s, kids were called hyperactive, and I understand in Turkey that that's what kids are called, not ADHD. And hyperactive was easy to notice because those kids, they saw moved around a lot more than other kids. A lot more, almost like they had a little motor in them and they can't control it. By the 70s and 80s, they were also recognizing that accompanying the activity level was impulse control difficulties, difficulty with attention, and extreme distractibility. Now, though, especially in about the last 10 years, they have discovered that those symptoms are actually, they're underlain by a developmental disorder with self-regulation or cognitive control. So there is a developmental disorder that makes it difficult for people with ADHD to have good control over regulating themselves. Things that the rest of us take for granted. So down here, the part of the brain that's affected has all of our major executive functions, we call it, our thinking functions. So down here, that means that this is areas of lacking sufficient self-control, difficulties with self-restraint, restraining yourself from doing things, even self-awareness, being able to, most of us can kind of step back and think, wow, what am I looking like or acting like right now? Or, I must look stupid, or I did good. They have difficulty with self-awareness, self-speech, where our little inner voice, we all talk to ourselves, rehearse things, sensing ourselves with and imagery. A big one is self-control of emotion. This is the last couple are pretty important. Self-motivation. ADHD kids can look like they are so lazy, they will not get started on a tough assignment. And I mean, you think, wow, what a great diagnosis to have. I get an excuse for having trouble doing a tough assignment. But it's really very, very difficult for them. And then in problem solving, when we are trying to reach a goal, but we run up against an obstacle and we have a problem, most of us are able to come up with a whole series of ideas. Okay, all right, I can't do that, so I'll go around it this way. Children with ADHD have great difficulty coming up with a list and then acting on it. Okay, in the United States, psychiatrists that diagnose ADHD, they do it with this manual, the Diagnostic and Statistical Manual of Mental Disorders. We call it the DSM, and it's in its 5th edition. They don't talk about the underlying difficulties with self-restraint. They focus completely on what we noticed way back in the 70s and 80s. They talk about people with ADHD have a persistent pattern of inattention and or hyperactivity impulsivity that's inappropriate for developmental age. So it might look appropriate for a 2-year-old, but when a 7-year-old is doing it, it's inappropriate for that age. So it's not totally inappropriate behavior, it's inappropriate for their age. And it needs to interfere with their functioning or development. Most of the symptoms have to have been present before age 12, and you also have to exhibit the symptoms in 2 or more settings, like at home and at school, or out in public and at school. And there also needs to be evidence that it's interfering with or reducing the quality of social, school, or work functioning. So they look just at those kind of symptom things. They say there are 3 types the predominantly hyperactive impulsive type, predominantly inattentive, and combined. Most people with ADHD have combined. They have both. Interestingly, the symptoms can change over time. So a person that's mainly hyperactive, that over as kids age, that does go down. Adults that were hyperactive as children and still have ADHD, many of them no longer show that needing to climb on furniture type of thing, but they report a real feeling of restlessness. They're tapping the pencils, they're smoothing their eyebrow, they're doing other ways to let that out. Okay, in the U.S., ADHD occurs in about 3 to 7% of the childhood population and 2 to 5% of the adult population. In Europe, the childhood rate of ADHD is just under 5%. And a study that was done in Turkey, a 4-year study completed in 2013, found a prevalence in Turkey of ADHD of 12 to 13%. That's kind of remarkable. It's much, much higher than the rest of the world population. I doubt that Turkey has tons more kids with ADHD, though. I was just chatting a little with Yasmin. One of the things I understand, that study was done at a public school. And I understand that private schools would not tolerate children with behaviors that were difficult to handle. So probably what's happening is public schools are, instead of having all children with ADHD go to whatever public schools are there. They are not in the private schools because they're weeded out. They're not allowed to attend once they begin having trouble. The ratio for children is 3, it's more common in boys than girls, 3 to 1. In adults with ADHD, it's 2 to 1, men to women. And it's been found to exist in virtually every country in which it's been investigated. It might not be referred to as ADHD, just like here it's called either hyperactive or attention problem. But there's little doubt that the disorder is virtually universal among human populations. Okay, the impact. More likely to drop out of school, a person with untreated ADHD. Actually more likely to be retained in a grade. Rarely do they complete college, even if they're very bright. And people with ADHD, they are across the spectrum of intelligence. Very intelligent, average, low, but rarely do they complete college. They have few or no friends. Because of the emotional piece of it, where they don't control their emotions well, they are not very good at the back and forth of friendship, the subtle things that we do. If they have ADHD as an adult, they generally underperform at work, engage in antisocial activities. These next two, I am thinking might not be as common in Turkey as they are in the United States, but girls with ADHD are more likely to have a teenage out-of-wedlock pregnancy, and girls and boys with ADHD that are sexually active before marriage are likely to have sexually transmitted disease, just because they're careless about things. More likely to speed excessively and have multiple car accidents. That's very common. Some of the personality disorders, depression, obsessive-compulsive disorder, oppositional defiant disorder, conduct disorder are also more common. They're comorbid with ADHD. Okay, these are getting down to kind of a general way of looking at the symptoms. Then I'll give you some really specific ideas of exactly what it would look like in your classroom. So first, impaired impulse control and a real inability to delay gratification. You want whatever's happening now is what you'll go for. You're not going to put off, I don't know, there was a study years ago, children that could have one marshmallow now, or they could wait a little while, and then they'd get 2 marshmallows. An ADHD child would always take the 1 marshmallow now. Okay, excessive task irrelevant activity, whether it's running around the room, pulling somebody's hair, looking in their desk, they're always doing something that's not related to the task that you would like them to do. Poor sustained attention or persistence to tasks, especially tasks that are boring, tedious, repetitive, and don't have intrinsic appeal. And we all might think, wow, actually I don't like those kind of tasks either. But most of us, since you're here in this room, I am betting that all of us in here have had some tasks in our lives, school tasks, that were exactly that. But we knew we had to do it in order to get what we wanted. And so we were able to gear ourselves up and do that. Children with ADHD are not able to gear themselves up. They just won't stick with it. Okay? A little more under that to help describe it. They have difficulty with something called working memory. And working memory is information that we hold in mind for just even seconds, very briefly. Most of our memories, most of the things that happen during the day, we don't remember every single detail. Working memory is kind of like the scratch pad of the brain, or post-it note. Information comes in, your teacher's talking about these directions. Okay, you're going to put your name at the top of the page on the right-hand side, and then right under that, I want you to put the date. Well, an ADHD child might put their name here and the date there, or wherever because they are not keeping that information for those few seconds for them to begin to act on what they're supposed to do. Delayed development of internal language. That's that private voice that we use. We may not be aware of it, but we're using it all the time to help us sort through things, to help us think about things for the future, to help us figure out, okay, shoot, I forgot my pencil at home. I'm going to have to, I'll ask this person next to me if I can borrow hers. You just think inside your head. They're not doing that. This is such a big one, and I'll talk a little bit more about inhibiting emotional reactions. It's not that ADHD kids have inappropriate emotions. Their emotions are fine. They don't know how to keep them inside in appropriate places, and when they do express them, how to moderate them in a way that isn't going to make everyone's hair fly back. So that turns out to be a huge, huge issue for them. And it plays a lot into the fact that many ADHD